Okay, welcome back. And again, thanks for joining for today's webinar, which is on thoracic cage or rib conditions, injuries, that kind of thing. So those of you who are, oh, look at that, the microphone is taking out my shoulder. There we go. I'll just move that back. Those of you who are new to these webinars, they're always recorded. So as long as you register, you should receive an email. It may take a few days up to a week to get the link, but they're always, these videos, webinars are always uploaded to our website. So go to bioflexlaser.com. At the top, it says support. When you hover over support, you'll see past professional and past personal therapy webinars. So you can find the webinars there as well. You know, it's interesting. Like I've been practicing as a chiropractor for over 30 years. And you know, one of the real common issues people would come in with would be issues with their ribs articulating with their thoracic cage. You know, we do a lot of rib adjustments, and it's a real common source of pain. And so, you know, over the years, I've gotten different requests for, you know, how to treat like costochondritis or, you know, different issues, rib fractures and contusions, those kinds of things. So while we do have excuse me, a standardized protocol, there are some modifications I'm going to suggest and some approaches on how to treat acute versus maybe more chronic conditions. So let's get started. I'm going to, as I usually do, is a bit of an anatomy review. And by the way, again, if you're new to these webinars, I do two types. I do one more leaning towards healthcare professionals that have our full professional laser therapy equipment. And then I do another stream more geared towards our consumer line of devices. Anyone can watch, they're complimentary. But just so you know, today's webinar is geared more towards healthcare professionals using the professional equipment, but certainly consumers can watch as well too. So I'll do a little bit of anatomy review, and then we'll go into some of the most common conditions, some I've already touched on, a little bit about their etiology and, you know, what happens, pathophysiology and symptoms and so forth. If you do have any questions, type them in the Q&A box. I'd appreciate that. That would be good. And if you want to chat amongst yourselves, then you can just do so in the chat box and ask questions anytime. I'm going to get to those questions at the very end of the webinar. Okay, so a bit of skeletal anatomy review. We have, look, starting anteriorly, we of course know there's the manubrium and the sternum and the body of the sternum. And this is where several ribs will articulate through chondral cartilage. This particular area is not contraindicated for laser therapy treatment. In fact, anywhere on the chest cavity is not contraindicated. Sometimes people get a little antsy about treating maybe over the heart, or maybe there's a pacemaker or whatever. That's not a contraindication. And really the reason for that is that this is light. It's not electrical current. So if there's a pacemaker, there's no light, or there's no electrical current being imparted into the tissue. So that shouldn't cause any issues. Not to mention, it's not going to have any negative effect on the heart. It lies pretty deep in the chest cavity, and really there's no negative interaction there either. Of course, anteriorly, we have the costal cartilages and the different ribs articulating. The clavicle articulates. Now, I'm not really getting into the clavicle because I consider it more part of the shoulder complex today. So we're going to stick more to the ribs and their articulations and the soft tissues associated with the ribs. There are really two ways of classifying ribs. They're either true or false ribs. Of course, there's typically 12 pairs of ribs, although sometimes there's an extra pair, or sometimes there's less. It all depends on your genetics, I suppose. They can be called true and false, or typical and atypical ribs. True ribs articulate with the sternum using their own costal cartilages, 1 to 7. False ribs articulate with the sternum using the 7th costal cartilage that is 8, 9, and 10. And the floating ribs, of course, don't articulate with the sternum at all, and that's numbers 11 and 12. You can see those in the red, the green, and the blue. So I think we're all pretty much familiar with those. Again, great, ask me questions. I will get to those questions for sure at the end of today's webinar, but you can ask and type them in so I can get to those at the end of the webinar. So let's start with the joints in the posterior aspect of the rib cage, costovertebral joints. This consists of the head of the rib. You can see the circle there showing the head of the rib of a typical rib. So it has two facets, upper and lower of the vertebral body. Each facet has a separate synovial joint, so they're actually a synovial joint. And of course, there's ligaments that hold it in place, including interarticular and radiate ligaments. Actually, I saw someone earlier mention about having to always go see the chiropractor because they have, ribs that need to keep being put back into place. And that's usually due to hypermobility, usually due to an injury. Could be like bronchitis, lots of coughing, or whatever injury is causing that. That's a tough condition. Maybe I'll chat about that as we go along. So costovertebral joint, you can see here what they look like and the ligaments that connect them. And then costotransverse joint, of course, that's a transverse process articulating with the rib. You can see here, and this allows more of a sort of a gliding movement. You can see the red circle, and there's different ligaments that hold it in place, including the lateral costotransverse ligament. Movements of the ribs and these joints are called pump handle or bucket handle movements. And essentially, they're quite small. They're kind of limited to some gliding and rotation of the rib head. And really, what their function to do is during breathing, enables the ribs to move upwards and outwards during breathing to expand the volume of the chest cavity. So that's really, they're subtle movements. It's not like you're detecting a lot of movement, but they're important movements. And if they're not moving properly, or there's irritation or inflammation, it hurts to take a deep breath in or sneeze or whatever because these joints are inflamed. Intercostal muscles, they comprise of several different groups of muscles that run between the ribs, essentially to help form and move the chest wall as well. These muscles are mainly involved in mechanical aspect of breathing by helping expand and shrink the size of the chest cavity. Three types you'll see here. There's, I'm just going to move that over here. There's the external intercostal muscles. They're at different angles as well, too. There are the internal intercostals and then the innermost intercostal muscles. So again, these help the ribs to expand and move during breathing, either moving closer together or farther away, depending on what's going on. Then anteriorly, we have costochondrial joints. You can see here outlined in blue. These are joints between each rib and its costal cartilage. These are commonly injured articulations, and it's oftentimes due to trauma. So sporting injuries is a common one, that kind of thing. Some types of, sports like tennis or a lot of torquing, that kind of thing. But you also see it secondary to other kinds of issues like chronic bronchitis and pneumonia. There's lots of coughing, lots of injuries that go on through there as well, too. These are primary cartilaginous joints, and these joints represent the demarcation of the unossified and the ossified part of the rib. So again, out front, it's actually cartilage that's the articulation between the rib itself. And then, of course, there's going to be the sternocondyle joints, which are the synovial costal joints between the sternum and manubrium and the costal cartilage. Now, these joints, with the exception of the first rib is more of a synchondrosis joint. It's a cartilage that directly united with the sternum itself. It's hard to see here, but I don't know if you can see where my cursor is, and that's kind of up through this area through here. The sternocostal joints are are fairly important for thoracic wall mobility as well. So these all play an important role in movement of the chest cavity for breathing typically, right? And they can be a real common source of pain and other symptoms. So speaking of other symptoms and conditions, let's talk a little bit about some of these common conditions and how you might use laser therapy. So a fairly common issue are rib fractures. So they can be traumatic or atraumatic. Oftentimes they are due to trauma, like car accidents, sports, even falls, blunt trauma to the chest. You do see those. Ribs 1 to 3 are the hardest to break. They're the strongest and signify if they do break, then there is a significant kind of trauma going on. Whereas ribs 4 through 10 are the most vulnerable for fractures, while ribs 11 through 12 are fairly mobile and therefore tend not to break. So typically you'll see ribs 4 to 10. These are the ones that tend to be most fractured. Of course, we all know about these kinds of issues in the elderly. Falls are a common etiology of rib fractures, and they're associated more with a higher mortality, even morbidity than younger patients. And of course, this might be due to less dense bone osteoporosis. And also, perhaps you might see fractures that are pathological fractures due to weakening of bone, say due to cancer metastasis from other organs. Through repetitive stress and microtrauma, athletes can also develop rib fractures with chronic use. So doing a lot of repetitive movements, they may weaken the bones and even cause fractures. You can get spontaneous rib fractures. So, person just wakes up or, wakes up from sleep or just whatever, and then all of a sudden they have a fracture, but this is almost always associated with very weakened bones, osteoporosis, or underlying lung disease like cancer, metastatic disease, right? Symptoms, it kind of makes sense, but let's run through it. Of course, you're going to have chest pain, especially when taking a breath in or a deeper breath in. Inhaling deeply, the more deeper you inhale, the greater the pain. Obviously, laughing, coughing, or sneezing. If someone has a rib fracture and you make them laugh, they're not going to be very, very happy about that because usually it's quite painful. Oftentimes there'll be swelling, redness, or even bruising around the fracture site. And depending on the location of the fracture, bending over or twisting your upper body may also trigger sudden pain. And of course, striking or pressing on the fracture, excuse me, will also cause lasting pain. Some common causes of bruised ribs or contusions. It's another common type of injury, but you tend to see this more with, again, accidents or sporting injuries or falls. They can be severe. It can be caused by severe prolonged coughing. So again, say you have a bout of bronchitis, that kind of thing. They can cause bruised ribs. Oftentimes it's because of trauma, and this will cause some bleeding, and then you tend to see this kind of, you can see in the diagram there, the bruising that appears, the hematosis. Obviously, there's pain, there's swelling, there may be some swelling, skin discoloration that goes from blue, purple, and yellow, signifying the stages of healing. Laser therapy is super efficient and effective for these kinds of issues, for bruising anywhere in the body, but because in the ribs they're relatively superficial, you throw on the array and you will get significant healing and reduction of the bruising and pain and inflammation relatively quickly. Of course, the bruised area is quite tender and sore, and the person may feel pain when they're either moving, that's typical, or sometimes even at rest if it's a fairly significant contusion. And of course, movements, coughing, sneezing, all those kinds of things. So pretty similar to rib fracture. Not always, but usually fractures are more painful than rib contusions, but sometimes rib contusions are more painful than fractures. So really the only way to tell that is through an x-ray. Doesn't typically alter the course of treatment, unless there's a displaced fracture or that kind of thing, but not normally. So although you would think a broken rib would be more painful, you may actually find that it's a bruised rib and not fractured rib. a so just a reminder, oh, good. Okay. You are putting your questions in the question box, not the chat box, which is great. Another condition that I say I've had at least 10 to 15 inquiries about from some of our BioFlex clinicians, and that's costochondritis. It's anterior chest wall pain. It's caused by inflammation. You can see here in the diagram in the red of the costal cartilage where they articulate, typically with the sternum, and they usually present with chest pain, and so oftentimes the doctors go, okay, we need to rule out that this isn't something more serious, like a heart attack or what have you. This is one of those weird conditions. Sometimes it's associated with certain things, sometimes it's not. I'd say it's a 50-50 thing where people just start complaining about it and they have no idea how they got this pain. It can be dull, it can be sharp. It presents weirdly sometimes. So you have to rule out other things to make sure it's not, it's not some other type of condition. So again, may be caused by an injury, may be caused even by strenuous exercise or heavy lifting, respiratory infections. Again, that's more from coughing. And some types of arthritis may also even affect that area as well. So the most common symptoms of costochondritis, of course, is pain and tenderness in the chest, anterior chest wall. I'd say usually it's pretty sharp with palpation. Oftentimes the pains increase with a deep breath or cough. And of course, usually less pain when you have less movement or taking more shallow breaths, then you tend not to have as much pain. Another fairly common rib issue is intercostal muscle strain. You can see the different layers of muscles there. And this can occur when these muscles have become weakened or overexerted, and may become due to trauma, from falling, twisting, car accident, contact sports, things that are kind of weird, like say you're playing pickleball and you're doing a lot of movements or whatever, or I still haven't tried pickleball. I play squash and I don't know. I know, like apparently it's, anyone, everyone can play, but I don't think I'm going to play that until I hit my 80s. So all you pickleball players can start going at me. So, those kind of torso torquing movements is very common to cause these types of intercostal muscle strain. Overhead movements. So like say you're painting a ceiling and you're doing a lot of, holding up that roller and painting it kind of thing. And then next day you go, oh, my rib cage is sore. It's such an unusual movement. And the way you're torquing those ribs, you actually may have strained some ribs, and it can take some time to heal. And because you're breathing and everything, right? You stop to breathe. It can take a little while to heal. Other sports like rowing, you see it a lot in rowing. So just pay attention to a good history of your patient to see what may have triggered potentially a muscle strain. Of course, the symptoms will vary depending on the severity of the strain. There may be gradual worsening of pain, and the pain worsening, within days or even weeks if the intercostal muscles are still under tension. So again, if they're still playing the sport or breathing, then you see it linger. But one of the most common sports for this is baseball, especially in pitchers or throwing repetitively. You'll see this because they're not allowing it to heal properly. Breathing pattern, it can be affected as well. It kind of makes sense because it is painful. And so that person might have short, shallow breathing. And you can imagine in elderly patients, that kind of thing, their blood oxygenation levels might go down. So this can be quite problematic. So this needs to be treated appropriately. And of course, with good palpation skills, you should be able to isolate if it's intercostal muscles or cartilage or bone or joint. So palpation skills and history should lead you to most diagnoses quite easily. Inflammation is pretty common because of the injury. You may also see swelling or a bit of edema in the area that's involved. In rare cases, there may be some swelling leading to a blood clot around the muscle, so there's some bruising or hematoma. And it kind of makes sense that coughing or sneezing, that kind of thing is going to make it worse as well. It's a pretty common condition, costotransverse pain. We talked about the two types of joints here. And these are disorders affecting the joints, the costotransverse or costovertebral joints and or their ligaments. So local joint compression may occur as a result of trauma or even muscle spasm. It's for whatever reason, it seems to be more common in women and can occur at any age. Oftentimes, I think when things are more common in women, it's just because women take care of themselves more and they report these things, and men tend to be a bit more boneheads about it and not see their doctors, and then things get worse. So, you know, bit of a caveman mentality there. Uh, so the other thing is that due to being at the top of the rib cage, the first costotransverse joint tends to be most affected for these types of issues. Another interesting fact is that RA or rheumatoid arthritis can also affect these joints. So it may be a sequela of this particular type of arthritis. Another thing is that costotransverse joint is known to be involved in patients with ankylosing spondylitis. So when combined with involvement of these costovertebral, sternoclavicular, and sternocleidomastoid joints, you start to get some rigidity of the thorax and increased dorsal kyphosis of ankylosing spondylitis. There's a little bit of research on AS, ankylosing spondylitis, and laser therapy showing that it's quite beneficial and helpful. So if you do have patients that have ankylosing spondylitis, laser therapy is a fairly effective treatment to help with the symptoms. I don't know if it's really going to slow the condition down, maybe a little bit, but certainly will help the joints and the tissues be a little healthier with reduced inflammation. Symptoms include posterior thorax pain, which may even radiate. So you need to look for radiation of pain as well. Going to the ribs, going to the shoulder, even the upper limb. Usually it's one-sided, but not always. Oftentimes with deep breath in or coughing and sneezing, it's increased pain. With passive or active thoracolumbar flexion, rotation, ipsilateral side bending, lifting, or twisting movements. So a good physical examination will give you some good insight into that. Hypomobility of these joints may also occur. That's mainly due to the muscle spasming in the area. And of course, there'll be pain with tenderness. Sorry, pain with palpation. There'll be increased muscle tension in the paraspinal muscles, rhomboid muscles, traps, levator scap. So oftentimes you have to treat those muscles as well. Great if you have a massage therapist or you work with a massage therapist or you're a massage therapist, and then doing work on the adjacent muscles is really important to help with recovery. Patient may also complain of secondary neck pain or headaches. Again, you might get referred pain into the shoulder blade, pain that increases with coughing or sneezing, those kinds of things. So you might get this atypical chest pain. So sometimes you have to rule out different issues as well. Lastly, neuralgia, intercostal neuralgia. This is a fairly common issue. Shingles is the number one, but I'm not really going to talk more about shingles, but more about, pinched or inflammation of the intercostal nerves. And typically you'll have neuropathic pain in the distribution of the intercostal nerve. So we'll run from the back all the way to the front, just like this little diagram shows you there. So, if you can replicate that pain or they're sort of drawing it out in that area, then it may be intercostal neuralgia. You may have some paresthesia as well, numbness and tingling. The pain may be intermittent or may be constant. And so there's this band-like pain that wraps around the chest and what appears to be a dermatomal pattern, although it's not a dermatome per se because it's a specific nerve. The pain may last for a fairly lengthy period of time. So these conditions can be quite challenging to treat. Usually sensory in nature, but occasionally you have issues with motor function of the intercostal muscles, but I think that's rare. And there's multiple mechanisms of why this occurs, and different treatment approaches. It could be due to trauma, it could be secondary to surgery, it could be due to rib fractures, nerve impingement, anything that kind of makes sense that they might have inflammation where that intercostal nerve is originating out from the spinal cord. Okay, so this is apparently about laser therapy, right? So let's talk about how you're going to use laser therapy. Well, lots of different mechanisms of why this is going to be very helpful in healing with scar tissue formation, muscle repair, reduction of inflammation and edema. And if nerves are involved, it's going to help repair the nerves. If cartilage is involved, it's going to help cartilage repair. And if there's fractures involved, it's going to help with callus formation and fracture healing. So literally all of these different conditions I just talked about, photobiomodulation or laser therapy would be really helpful in healing. And let's face it, person has a rib fracture or rib contusion, what are you going to do as a chiropractor? I can't do anything for that. Some of those other ones I can, but fracture, right? Rib contusion, what are you going to do? I was going to say, who are you going to call? You're going to call on laser therapy because really it's going to be quite beneficial. So this paper it was on mice. Now, mice have ribs, right? And I thought it was interesting because they used red. Oh, my cat is crying because he looks staring at a squirrel. All right. So I'm going to ignore him. So interesting enough, they used red LED. And I wanted to mention that because some people are just like, oh, it has to be laser, laser, laser. It's like, no, it's called photobiomodulation because LEDs can be very helpful. And when it comes to treating like rib issues and everything, LEDs are quite beneficial because issues aren't that deep and you can get a lot of, and usually it's big area. So having LEDs is quite helpful. So what they want to do is to see if red LEDs help with pain and inflammation and sort of what it did. So what they found was when they used red LEDs, they were able to help decrease swelling and help the reduction of migration of inflammatory cells to an induced area of inflammation on these mice. So one of the mechanisms of how laser therapy is going to help is to reduce pain and inflammation. And if there's any swelling, reduce swelling as well. So I thought I'd go into some depth here. No, just kidding. So we don't need to know all this. Well, not that there's a test, although you know what? Maybe that's an idea. Maybe I should do a test after every webinar. And if you pass, you can watch the next one. So no, kidding. So the reason why I put this chart up is that the concept of inflammation is really super complex, as you can imagine. And there's all sorts of mediators secreted by different immune cells. Some are pro-inflammation, some are anti-inflammation. They might alter when they're released. And what's really been studied quite well now is how photobiomodulation can immunomodulate these cells, these white blood cells, and help control and reduce inflammation in different ways. So Michael Hamlin, who you may have heard of before, he's now retired, but he's really considered the guru of photobiomodulation and laser therapy. And he put out this paper on the anti-inflammatory effects of photobiomodulation. And, he looked at all the research, he does a lot himself. And what he concluded and they found was that inflammatory cytokines like interleukin 12, 1 beta, 6, 8, and 20, there's some others as well, are all decreased when these immune cells are exposed to red and infrared light. So it shifts the secretion of pro-inflammatory mediators and slows them down or starts shutting them down, and therefore inflammation goes down and therefore less pain. This phenomenon isn't like doesn't happen like immediately. It may take a day or 2 days or 3 days. Sometimes people have a response right after treatment, which is great. Another way that photobiomodulation help is how the macrophages, again, another inflammatory white blood cell, can change its phenotype. So think of it this way. It's kind of like you have Clark Kent, and then you have Superman. Clark Kent is M1 phenotype, Superman is M2 phenotype. kind of same person, but they look different and do different things, right? So macrophages can take on two different phenotypes. Never used that analogy before. I have to remember about that one. So research has shown that red and near-infrared wavelengths seem to stimulate M2 macrophages and lessen M1 macrophages activity. And this directly promotes anti-inflammation, angiogenesis, and tissue healing. In other words, M2 is what you want, M1 is what you don't want. So you want to go from Clark Kent to Superman is, I guess, my kind of thing I was saying. And the reason why I mentioned this is that if you want this anti-inflammatory or this sort of macrophage phenotype phenomenon to occur, they found that it was occurred at much lower energy densities, like 1 to 10 joules per centimeter squared. So this is the one thing that I'm going to rant a little bit just quickly, is that when I go to conferences or even have discussions with people that say, you know, I want class 4 laser therapy, or class 4 laser therapy guys say this and blah, blah, blah. And like, they don't look at the research. It's really important to understand that photobiomodulation usually works best at relatively low. That's why it used to be called low level laser therapy, although it wasn't a great description, like what's low. But we know from this research that these lower energy densities are actually more beneficial. So if you're overdoing it and you go, why, it's not helping, then you go to even more energy and it's still not helping, and you go, oh, it doesn't work. And class 4 uses tons of energy, like way too much energy. And it blocks pain, but it doesn't do these types of anti-inflammatory effects, even though they say it's laser therapy and they quote all the research, but all the research uses low energy. They don't use class 4. So it's like saying, you know what? Eat your vegetables, doesn't matter what vegetable, and then you go to eat poison ivy and you die. And it's like, whoa, it's a plant. And it's like, yeah, well, maybe that wasn't the plant that, no, it's not a good analogy, but you know what I'm saying? So so if you want quick pain relief, yeah, class 4 is the way to go. If you want to heal your patients and get the effects of photobiomodulation, then you need to use lower energy densities. Okay, into rant. So let's say you have a muscle strain, okay, that we've talked about, intercostal muscle strain. You irradiate with red and near infrared light. You're going to promote satellite cell. These are myosatellite cells in the torn muscle tissue. It will help these cells repair faster. You'll start to get release of all sorts of growth factors in the area, and you'll start to improve collateralized circulation in the area to help heal faster. It's another way that photobiomodulation is going to help with a muscle injury, for example. So laser therapy also produces an early recruitment of inflammatory cells, as well as a higher amount of granulation tissue and increased deposition of newly formed bone in the area. So when you have a fracture, photobiomodulation, that's the old term LLOT, produces a significant increase in expression of genes responsible for stimulating osteoblast proliferation and differentiation. So in other words, it stimulates osteoprogenitor cells and the differentiation into matrix-producing osteoblasts, and this increases the rate of bone formation and bone ingrowth, like callus formation. That's kind of what you want when you have a fracture. Really easy to get to, and this is one of the classic examples where you can use photobiomodulation for fractures because there's nothing in the way. You take off any straps or whatever, you can get to the bare skin, and so they respond extremely well. So, you know, this would definitely be highly recommended for that. Okay, so how are you going to use your equipment? We're going a little bit over time. Sorry about that. So we do have an inflammatory protocol, and this is what it looks like here. Now, I want you to pay attention to the stage 1. And there's two choices, continuous wave or 50-50. It presets for continuous wave, but I'm going to ask you to do is to customize it and choose 50 hertz and 50% duty cycle for the red. So it's a pulsing light. You probably won't really see it. But again, what we're trying to do is reduce inflammation here. And the lower the dosage, probably the better in this scenario. So pulse it out at 50-50. And in the infrared, you're going to go go with 1030. So it's very low pulse rate and very low duty cycle. So the dosage initially is relatively low. So anytime you have an acute scenario, acute fracture, contusion, strain, these conditions I've talked about, within the first week or so, throw on the inflammatory protocol and stage 1, customize it 50/50 and 1030. It will preset to 1030, so you can use that. And then as you go along, if after a few days in the acute stage, and if you feel it's necessary to increase the stage 2, then you can increase the stage 2. That's now a little bit more dosage, continuous wave, and usually 50/40 is the infrared. And then within a few days to a week, usually around that time frame, you're ready for the thoracic spine protocol. And you can start using that with the stage 1. That's continuous wave. You see it's 50/50, so it's a slightly higher. You can go up to 50/80 as well with respect to frequency and duty cycle. So a little bit more dosage over the area geared more towards healing. And then again, after a few sessions at that stage 1, if the progression is slow or stalled, you can increase so stay in stage 1, increase the dual plus infrared to 80% duty cycle. And this represents, sorry, spelling mistake, the highest level within stage 1. And then again, if the progression continues to be slow or stalling again, you can jump to stage 2, which is 190 for red and then 50/90. So pretty high percent duty cycle, high dosage, a little bit higher dosage for healing. So a few tips here is the treatment array should be placed to cover the entire surface area over the rib condition or the injury. And this, of course, may take several placements. In the case of neuralgia, you want to treat over the origin of the nerves at the spine and also the path of the intercostal nerve laterally and anteriorly. I have a little diagram to show you what I want you to do there. Be careful with rib issues when you're using the equipment because you don't want to use straps, you don't use weights, and the dual arrays, the larger plastic metal ones, they're kind of heavy. If you do have our silicone ones, they're great for this application because they're much lighter. You can still use these, but you have to be very careful how you're placing them on the patient. Usually they can tolerate it. It's not that heavy, but don't compress it or push in like you would in other areas of the body, because obviously that's going to be painful. When you're using the laser probe, you want to vary the time per point, depending on the type of tissue or depth that you're treating. Trying to get light into bone, it's relatively dense type of tissue. I'd suggest that you hold a little bit longer, maybe up to 15 to 20 or even more seconds per point. Muscle, maybe 10 plus seconds per point. Nerves are very sensitive to light. You don't need to hold it as long. 5 to 10 seconds is usually adequate. Joints tend to be a little bit deeper underneath muscles, so oftentimes hold a little bit longer to direct it into the costotransverse joints, for example, or 10 to 15 seconds per point. Okay, so remember the laser you're targeting in the specific areas that are injured. So just recall that if you're looking at the dual array, just where the diodes is where you're having the treatment. So make sure you apply those diodes over the area. So, you may place it vertically on like a diagram on the left. That would be over the costotransverse joints, anything to do just lateral to the spinous processes, and then overlying the costotransverse joints. Or you may want to do a vertical placements if it's involving the intercostal muscles or the intercostal nerves. Sometimes you might want to do it, if you're treating the front of the chest, which is what's showing you here for, say, costochondritis, just place it vertically along the length of the costochondral joints or sternocondral joints, whether it's right or left or bilaterally. I think that makes sense. For intercostal neuralgia, you'll want to treat again the origin of the nerve and then of course it wrapping around the lateral cage or the lateral aspect of the cage and the anterior aspect where it's radiating out as well. Okay, before we get to your questions, next webinar is more towards consumer level devices. It's how to use the equipment for eczema, psoriasis, and common skin conditions. We have a couple of events coming up. Light Up Your Practice in, whoopsie, in Cambridge. That's early June. So if you're in the Cambridge area or you want to go out to Cambridge to see us live, I believe it's, I don't know, it's like $100 or something. We're doing a whole session there. So you're welcome to join us there, and you can click on it to register. And then we're doing one out in Calgary, Alberta, an all-day event, and that's at the Massage Therapy Conference, Samota. I believe that's in Calgary. It is in Calgary, it says that. I was also told to mention that we're having a Mother's Day special. Who's more special and needs care than your mom, right? So if you don't have a device for your mom to use at home, you're not being a good son or daughter. So I'm going to suggest that you buy one. Just kidding. Just doing a little promotion here. There is a sale on right now, so you can save a significant amount of money if you go to our website. That's bioflexwave.com or bioflexlaser.com, and the personal systems are also on sale. Okay, so I did that spiel. All right, so let's see some questions here. With scoliosis and 77 years old, does pain or aching in the back at waist, more on the right side, probably mean an adjustment is needed? Scoliosis 77, does pain or aching in the back? That's kind of a generalized question. I really wouldn't know. I just know that when you're dealing with that age group, especially if it's a woman, manipulation is a little sensitive. You have to be, the clinician and chiropractor has to be really careful. So usually just by palpation, they can tell if it needs to be adjusted or not. And there's other easier techniques like activator techniques, mobilizations that may be helpful there. Have there been any webinars on scoliosis? You know, that's a good question. I don't know if I've done one specifically on scoliosis, and maybe I'll just do one. Thanks for the idea. Fractures, repair enhancement rates. I'm assuming, Richard, you mean how much quicker it would be if you had laser therapy? At least 20, 30, 40% faster recovery healing using laser therapy. Contraindications and alterations to treatment settings in the young. Well, generally speaking, when you're dealing with younger clients, that is like young adolescents or children, you want to treat with a lower dosage or shorter treatment time because they don't need as much dosage. So that might be 20, 30, 40% less. In the professional equipment, you can adjust for that by their age, or you can just customize that in as well. What category would compressed ribs be in? Well, there's not really such thing as a compressed rib. I don't think, at least not that I'm aware of. I think what you mean by that is where the ribs are maybe irritating, where they articulate, and that would be more costotransverse irritation, joint irritation, joint inflammation that I covered earlier, Donna. So I'm assuming that's what you mean. Treatment of fractures underneath the scapula or including the scapula, any treatment setting suggestions? Yeah, so for there, you're going to have to rotate the arm anteriorly and the scapula forward to get the scapula out of the way as much as possible. That's all you can do because the scapula will block some of that area. Alteration of treatment settings when neuralgic pain is sensitive to standard treatment. Yeah, so if neuralgia can be super sensitive. So you could use a shingles protocol for that. If you're interested in that, you can email me. That's a much lower dosage as well, or just literally lower the dosage even more for neuralgia. Can you use PBMT for MCAS? I don't know what MCAS is, so you're gonna have to let me know. Is it okay if you use laser on the couch and the? Okay, that question is about leaning back on the array into a chair or couch or whatever. I don't recommend that because it has to give off heat and it will get hot. So and you need to keep it exposed to air as best you can. So I'm going to recommend that you don't do that, or you monitor it extremely carefully, and that you give it a chance to let go of its heat, dissipate its heat in between sessions as well. So not normally would I recommend that. Why don't you use 700 range of wavelength as they penetrate deeper than 800 ones? Oh, okay. Well, the so actually the deepest penetration range is around low 800s. So I'm not really sure why you say 700. In fact, 700 is never used because it's not effective, because it actually doesn't interact with cytochrome C oxidase. So I'm not quite sure where you got information, but if you look at like 99.99% of all the research, they're going to use 630 to 660 to 680 and 780 sometimes, but you're pushing into the 800s vast majority of the time. Those are the wavelengths that penetrate deeper and also avoid absorption by other coexisting photo acceptors like water, melanin, or what have you. So I'm not quite sure where you got that information, but I don't think that's accurate. While treating posterior shoulder blade region, should we use dorsal spine protocol or shingles protocol or shoulder protocol or rotator cuff protocol? Posterior shoulder blade region. If you're treating the muscles of the scapula and the glenohumeral joint, the shoulder injury, use the shoulder protocol. If you're treating specifically rotator cuff, you can use a rotator cuff protocol. It's pretty similar to shoulder, just some slight differences. You would use the thoracic or dorsal protocol if you're treating ribs directly or the vertebrae, the thoracic vertebrae. Mast cell, laser for mast cell activation. It does have an effect on mast cells for sure, but it's an isolated kind of effect, and it's not going to have a systemic effect on mast cells. So I don't think it's going to do much for that. Clavicle, not rib, I know, but treatment same as per ribs. Oh, so I would say no. I would say if you're treating the clavicle, I would use a shoulder protocol, especially the AC joint and even the SC joint. I would use the shoulder protocol, Richard. Looks to me like that was it. Oh, Mike said I couldn't handle pickleball. Yeah, probably. Not for the faint of heart. Yeah, I know. I hear the pickleball players. They say it's a pretty fast moving game, but I don't have my key in my rocker, so I don't know if I could handle it either. Maybe. Hey, Mike, are you a big pickleball player? I'll have to play you next time I see you. All right. Thanks a lot, everyone. Have a great afternoon, and we'll see you next time.